Hi there. So there's been an upsurge in dengue cases in northern India and especially in the national capital. In November alone, we've seen over 5,600 dengue cases. This is a big, big number. What is causing this? The government says that this time over, the deadly dengue strain, the D2 strain, is something which could be responsible, but also the untimely rains, the untimely, unseasonal rains. Joining me is Dr. Parinita Kaur. She's from Akash Hospital. She's a consultant internal medicine, and also Anshul Singh, who's been tracking the dengue outbreak in the national capital and also the politics behind it. Dr. Parinita, let me come to you first. 5,600 cases. This is a worrisome number, isn't it?
Yes. So, Runjan, I just wanted to say that every 3 to 4 years, there is a surge in dengue cases. And I think this is the year that came after 3 to 4 years. We've had a surge around 4 years back. And this time around, again, we've had a big surge in the dengue cases. Um, and of course, the rains are to blame for it, but also the cyclical nature of the dengue virus.
And July to November is when dengue stays. And of course, with the onset of winter, slowly we see it fizzle out because the mosquito then no longer can breed in those temperatures. Anshul, if you could get a sense of numbers from the national capital, are the numbers going down now with the onset of winters?
Yes, Ranjan, definitely. So, till November, more than 5,000 cases have been reported in the national capital itself. But yes, the caseload on the hospitals have gone down in the past few weeks. As I got a chance to talk to a few doctors from government hospitals in the national capital, they said that what was bed occupancy of around 50 to 60% over the last 2 to 3 weeks has gone down to around 10%. So yes, the number of cases are coming down. So Delhi in itself has reported more than 2,500 cases over the month of November. That is the first 15 days of November, and the rest 2,500, more than 2,300 to 2,400 cases have come out from neighboring states who are getting treated in hospitals in the national capital. So an accumulative figure of 5,000 made to it. But yes, the good news is that the number of cases and the number of people admitted in hospitals are going down, and the mortality rate or the fatality rate has also been very low because of dengue. So yes, good news for the people of Delhi. As the temperature goes down, we will see that these mosquitoes get even more inactive as soon as the temperature goes below the 20-degree Celsius mark.
Now while Anshul is pointing out that with the onset of winter, slowly the cases are going down and even the mortality, so to say. But this year, not just in the capital, but in northern India especially, we've seen that there's of course been an upsurge in the dengue cases, but also in deaths pertaining to that. Dr. Parinitha, I'm going to ask you, what are some tips that people should keep in mind as far as the dengue fever is concerned? When is a good time to reach out to a doctor to get medical help, because most people think it's a fever and it can be treated at home.
Yeah, so that's a very important question. What happens in dengue is that there are two phases. In the first phase, in the 4 to 5 days, the first 4 to 5 days, the fever is very high. So whatever you do, the fever stays about 103 and 104 and beyond. There is severe pain in the body. It's called a bone fever. So there's severe pain in the body, in your joints, muscles. The patients are just they've never experienced this kind of pain earlier, so they panic and reach out to the hospitals. So there are two things that I want everyone to remember here. Is the first thing is that this is not the time which is critical. So it's okay to have fever. You have medications for fever, and the only medication that you should be taking is a paracetamol, the good old, the friendly paracetamol, which will take care of the fever. And please do not panic if the fever does not come down, because that is how it's going to be. So first of all, let us take that off our minds, that the fever has to come down. And if the fever is not coming down, then we are not treating properly. The fever is going to stay, it is going to come back in every 4 to 6 hours. So you can repeat your paracetamol after 6 hours. Do not panic if it is not going down. Please don't use the harsher medications for bringing down the fever, which are like the good old combiflams and the Vovarans and the sumos and multiple other medications which bring down the fever very fast and effectively, but also they can bring down the platelet counts.
Yeah.
So it's important that you stick to the acetaminophen or paracetamol, and do not panic. For the first 4 to 5 days, the fever is going to be there. What the patients need to do is maintain their hydration, have good amount of fluid, whatever they can lay their hands on, whether it is a electrolyte solution like an ORS or electrol, or they are coconut water or lime water, or even chach or dahi and lassis at home. Stay away from tea, coffee, aerated drinks. Take lots of fruits and fluids. So just to keep yourself hydrated. Do not panic. There is no need for any kind of antibiotics also in these first 5 days. So no need to rush for an antibiotic or for the non-steroid anti-inflammatory drugs.
So
So
the
that is
good
the
old paracetamol is what one should stick with, as
yes,
Dr. Parinita is
absolutely.
pointing out. Anshul, what is the sense that you get from the ground? Do people indulge in a lot of self-medication, and do you think that's where also things go wrong, and then it leads to a situation where it's difficult to salvage?
Definitely, definitely. Especially after the pandemic, we can say that a doctor has been produced in each and every household. So yes, people. This has what been doctors have been pointing out regularly, as just ma'am pointed out that no need to panic and don't no need to be a doctor and an expert in yourself. Get yourself treated. Go ahead with the normal paracetamol. That could work wonders. But yes, doctors have been produced. We even saw cases of black fungus coming because of over medication of dengue medicine. So yes, people have been doing that, and doctors have been specifically pointing out to not take such actions, especially without the help of an expert. So yes, this is something that is being happening, and yes, people are self medicating, whereas what we see from the government's effort to cure the spread of dengue this year, this has been a very lax effort from the government, both by the Delhi government as well as the MCD, because I got a chance to talk to them, and they were both shifting blames on each other. But yes, the kind of preparations that we saw for dengue this year, the anti-mosquito foggers, all this was very few in numbers, and that is one of the reasons. That is why we are seeing a slight spike in cases this year even.
Thanks for pointing that out, Anshul, because it's extremely unfortunate. We see that play out every year. The MCD blaming the Delhi government really taking the MD back. And at the end of the day, we see that those mosquito breeding spots, places which are waterlogging, is something which the government really doesn't do anything about. And therefore, we see that despite the upsurge in cases, um, because of spots like these, mosquito breeding spots, really the numbers don't go down. Now, this is something which can be prevented, but unfortunately is not. Now, Dr. Parinita, there is no vaccine for dengue as of now, but there are several preventive measures that one can take. For example, wearing full sleeves clothes, using mosquito repellents, using mosquito rubs and sprays these days. Do these things really help? Can preventive measures really make sure that you can survive the season in June, July, where you really see this outbreak of dengue?
Absolutely. The dengue mosquitoes or the Aedes mosquitoes, which spread the dengue virus, like to stay in fresh water. So, if we avoid, first of all, any kind of accumulation or waterlogging in and around our houses where we dwell, that is the first step to prevention. And then, of course, wearing long sleeved clothes and wearing mosquito repellents on our skin or even on the clothes. So all that can definitely prevent the mosquitoes from breeding, from biting. Also, in the house also you can have the mosquito sprays and use mosquito nets, because even if one person is affected with dengue at home, the mosquito and the mosquitoes are there, so they can always bite and then spread the disease to other parts, other people in the same family. So that's a very, very important thing to do at home.
And my hope is that there can be more and more awareness as far as preventive measures of dengue are concerned, because despite these very small steps that can help you avoid this deadly killer disease, we see the outbreak happen every time. We see people not clearing up their water coolers, for example, on a timely manner, so that the breeding of the Aedes mosquito is avoided. But also, of course, the governments, the authorities not doing enough is a reason why we see the number of cases swell so much. Anshul, if you could tell us uh, some of the measures which are taken by the Delhi government, which has now helped, because I think after the upsurge there was a lot of fogging happening. Like in my college, it started much late, but is it still happening, or do you think that now, since it is the onset of winters, once again, the government has become lax, both the government and the NCD? What is the sense that you're picking up from the ground?
The sense that I picked up, I got a chance to ask this question to Arvind Kejriwal a few days ago, that what is the Delhi government doing for the upsurge in cases in national capital, and he said that the number of cases will come down due to the onset of monsoon. He didn't say a word about anything that the government is going to be doing to make sure that the cases do not spread anymore. But yes, he said that the weather will change and things will get down. So yes, the seems like the Delhi government is also waiting for the weather to change. But on ground, yes, we can see a lot more of foggers and other preventive measures being taken place. The people from MCD are sharing their videos that they are going door to door and trying to tell people to uh, vacate water from their houses, stagnant water from their houses. So these are some of the steps that are being taken, but the prominency of these steps are still definitely in question, and the uh, scale of these things are still in questions, as these are very few and a very limited number of people that are currently involved in this and trying to help people to tell them the preventive measures
So
to have from
the
dengue.
option that people have is, if they can't rely so much on the authorities, at least take care of yourselves. Like Dr. Parinita pointed out, make sure that your surroundings are clean and hygienic. There's no water which is collecting anywhere close to your house, or even in your house for that matter. But if you do get that fever, that break bone fever, which stays on for a few days, um, don't don't indulge in self medication. Always seek out for a doctor for medical help. Also, at a point where there's abdominal pain and incessant vomiting, that's definitely a time where you should pick up your phone and call that doctor, or sit in your car and go to the doctor. Is that correct, Dr. Paramita?
Yeah, so I think that's an important point, and also we should be in touch with the doctor right from the very first or second day of your fever, because that is when they will guide you correctly. They'll calm you down, they'll reinforce that the fever is going to be there, and they will advise the correct tests at the correct time. Going
And
ahead and
what
getting
if you could tell us, Dr. Paranita, what is the time where you need to be admitted into a hospital? Because a lot of people
yes,
panic, and in the first few days when there's only fever, they want to get admitted to the hospital. But is there a right
yes.
time per se?
Yes. Yeah. So I'll just say two things about. First is when to get the right test done. There are two types of tests in dengue to identify the cause of the fever. So there is an antigen test and an antibody test. The antigen test is only positive for the first, second to fifth day. So if you're getting the antibody test done in the first 4 5 days, it's of no use. Similarly, if you get the antigen test done after the fifth to seventh day, then it is again no use. So don't go ahead and get a test done all on your own, and don't just say get the tests for platelets done right on the second third day, because that is not when they are going to fall. The platelets are going to fall after the fifth day, and they are going to fall. So there is no question of why the platelets are falling even if we are on medication. They are going to fall. Please take it for granted that they're going to fall. How much? Nobody knows. So for that, it is important to get yourself tested and get your platelets done on a daily basis after the fifth or sixth day, if your doctor feels that necessary. That also the doctor will decide whether it is required or it's not required, and what is the frequency of testing. Secondly, if you are not able to eat, drink, maintain your hydration, like in the first 5 days, I told you, it's only a paracetamol and hydration. If the patient is not able to hydrate himself well, there are, he's not even, it's okay if you don't eat all the meals, but it's important that you drink enough water and maintain your hydration. So if it that is not possible, if there is a lot of abdominal bloating, vomitings, there is a reduced urine output, the patient is feeling breathless and unable to breathe easy. So those are the timings. Then you should not keep the patient at home. You should not just be trying to bring down the fever, because that is going to put extra stress on your kidneys and on your liver. And the delay that happens in hospitalization often leads to lethal outcomes. And because of this, because of a simple thing like a dehydration and not managing the fluid properly, can lead to fatal outcomes like a liver failure or a kidney failure. So that is something which is avoidable. And being in touch with your doctor and getting the right kind of guidance will help you in sailing through. So right test at the right moment, hospitalization at the right moment is very, very important.
Thank you. Thank you, Dr. Parinita, for some of those tips. I'm sure our viewers really, really appreciate that. And like Dr. Parinita Kaur pointed out, stick to that good old paracetamol, stay hydrated, don't self medicate. Anshul pointed out a lot of people do that. And that is something that can really lead to worsening of your case. Thank you, both Anshul Singh and Dr. Parinita Kaur, for joining us. Thanks for watching.
Thank you. Thank you for having
Thank
me.
you.